Press conference. Today is Friday, May 22nd, 2020. I would like to first start off by a proclamation that I think is very fitting and appropriate this week as we begin, or actually wrap up this week. The beginning of the week was National Emergency Services Week. What more fitting tribute to have than during this COVID-19 crisis, but recognizing our men and women in the emergency medical services field. This was established back in 1974 by President Gerald Ford, and proclaiming a week for emergency medical services. This year's recognition was held from May 17th and goes through the 23rd. Everyday medical personnel across our community are committed to providing life-saving services to our residents and visitors. And during the COVID-19 pandemic, EMS personnel continue to serve on the front lines by taking efforts to prevent the spread of the virus, providing medical assistance to residents who may have had contact or who may have COVID-19 or be experiencing other life-threatening medical situations. Our Chautauqua County Office of Emergency Services has been instrumental in ensuring our first responders with education, law enforcement, healthcare workers, and other sufficient quantities of PPE or personal protective equipment. I therefore, by power that I have as county executive, do hereby proclaim May 17th through May 23rd as Emergency Services Week, something near and dear to my heart, as 30 years of my life have been spent with the local fire service, 26 of those being an EMT here in Chautauqua County. So hats off to all of my fellow men and women, brothers and sisters in the emergency services field for all they have done and continue to do during this COVID-19 crisis. I thank them and their families, because this is not just a single person event, but yet many families are involved, and the work they do does reflect back on their families. So to recap this week, we're going to go back to Saturday the 16th, where we had 4 new cases of COVID-19, bringing our county total to 50. And at that point, we had received 1,690 negative tests as of that day. Sunday, there were 3 new cases to announce. Monday, there were no cases to report. Tuesday, 1 new case. And that's when we had announced that Western New York, including Chautauqua County, had moved into the Phase 1 reopening. Wednesday, we had 3 new cases to announce. Yesterday, another 3 new cases, bringing our total to 60. Today, we have 10 new cases to announce. They include the following: 1 individual under the age of 18, 2 young adults, a female in her 20s, a male and female in their 30s, a male in their 50s, 2 males in their 50s, and 1 female in her 60s. This now brings Chautauqua County's total of confirmed cases to 70. There are currently 28 active cases in Chautauqua County, and 38 have fully recovered. There are 4 deaths that have occurred during this COVID-19 crisis, and I think the important information to convey to the residents is there are no current hospitalizations due to the COVID-19 virus here in Chautauqua County. 118 are under quarantine or isolation orders and continue to be monitored. This is down from yesterday's total of 202. And to date, we have had 2,143 tests returned to Chautauqua County as negative for the COVID-19 virus. At our Phase 1 reopening press conference on Tuesday, I issued a challenge to our residents. And that challenge was to continue with all of our social distancing and prevention measures as we progress to the Phase 1 reopening. We have seen that these measures have been working, and we must continue to be vigilant as we reopen. We also stated that as things begin to open and testing supplies continue to increase, there will certainly be more positive cases. This was reiterated by Dr. Bott, the geostatistician on the governor's team, as we announced the reopenings early in the week. If we all do our best to adhere to social distancing and prevention guidelines, we can continue to minimize the impact and keep these numbers low. Again, the importance of even 10 new cases, none of those cases are hospitalized. The announcement of new positive cases this week reflects the following observations. While the positive cases are likely due to contact before the reopening, given that there is a 7 to 14-day incubation period of the COVID-19 virus, it shows that it continues to be important to social distance, wear your mask, avoid gatherings, and limit your shopping trips. I have seen and heard from many people who are very frustrated with our social distancing and being on pause when we were. If you have spent a few hours on Facebook or social media, you've probably seen it too. But I'm confident that we can together work to rise to the challenge, to protect the health of our family and neighbors, and now the health of our businesses and our economy. The last thing we want any of us to do for our metrics to increase to the point where we entering phase 2 would be delayed, or we would have a backward slide. This time I'd like to turn the microphone over to Christine Schuyler, our Public Health Director.
Thank you, County Executive Wendell. This pandemic is very far from being over. Experts say that we could be looking at 1 to 2 years before this pandemic is over. We really need to have a vaccine that works and that we have a large portion of our population vaccinated. While we are beginning to reopen, COVID-19 hasn't disappeared. We didn't go into a quarantine or a lockdown thinking that this virus was miraculously going to go away while we weren't out circulating. The virus was circulating. Quarantining has slowed the spread of the virus. But the virus is still here, and it's here in every community in our county, and it's here in persons with or without symptoms. It does not discriminate based on age or gender or race or religion. More people who are together will mean more people sick. That's common sense. This is a respiratory virus. What we don't know a whole lot about it still. We are learning more. One thing that we do know is that the main mode of transmission is respiratory droplets. That is why it is so important to cover your face, covering your mouth and your nose to keep your germs to yourself. Washing your hands, not because you're going to catch something through your skin, but because we are human and have this habit of touching our face frequently. And that contact with something dirty into your mucous membranes of your eyes, nose, or mouth is how then those respiratory droplets get spread and you get sick. The governor this week, as of yesterday, said that religious gatherings could occur for 10 people or less with social distancing taking into effect. That didn't mean that he lifted the restrictions on any other social gatherings. The 10 cases we have today, I can confidently tell you that 9 out of 10 of those cases were close contacts of an already positive case. That is evidence of how contagious this virus is. And when people gather together, people get sick. So I'm really asking you to remember that reopening is not a race. Please wash your hands, cover your face, and respect 6 feet of space. I've got 2 questions for you as we go into this Memorial Day holiday weekend. With COVID-19 restrictions just starting to relax, are you ready? If you're diagnosed with COVID-19 tomorrow, are you ready to provide a list of everyone that you've been in close contact with? If you're listed as a close contact of a positive case, are you ready to spend the next 14 days quarantined away from others? Again, this is not a race. We need to be cautious. We need to use common sense. Please help us, help you, help your loved ones, help our whole entire community to stay healthy.
Thank you, Christine. The point we've seen, the governor has allowed religious gatherings and small gatherings of 10 people, but that doesn't mean, as we've said, that the doors are open and restrictions are lifted across the board. We continue to stay vigilant with our efforts. I was on a conference call earlier with Cattaraugus and Allegheny County, and they can't stop but utter the same words. Phase 1 reopening is just that, phase 1. It is not a complete lifting of all the restrictions that the governor had put on, and we're free to move about our communities. We still must err on the side of caution and remember when in public to wear those face masks, as that is how the disease is spread most commonly and most frequently. and we need to adhere to those policies. At this time, with some really exciting and good news for our community and our county, I'd like to introduce the Deputy County Executive for Economic Development and CEO for the Industrial Development Agency, Mr. Mark Geis.
Thank you, County Executive Wendell. Before I talk about the really good news, I'll talk about the good news that we heard on Monday and just kind of reiterate what we discussed at the last press conference. Businesses need to go to the forward.ny.gov website and comply with the guidance provided by the state. Just to remind everyone what the phase one business, who the phase one businesses are, it's construction, it's agriculture, forestry, fishing and hunting, retail trade, manufacturing, and wholesale trade. So those businesses, before they can open, need to go to the New York Forward website, and there's 3 documents on that website. There's general guidance, which really applies to almost all of the businesses, and it follows very closely with the CDC and the OSHA guidelines. There's a detailed guidance, which is more specific by business sector, and at the end of that detailed summary, there's a link that you click on. There's about a 2-page questionnaire that asks for contact information, the business type, and that affirms once you fill that out and you send that goes to the state to affirm that you've read the guidance, and it registers with them that you've done that. And by the way, we've had about 100 businesses so far that have done that. The state notified us of those businesses, so that's good, and we need more to do that. And then the third document is a template, and that template needs to be completed by the business. It needs to be printed out. It needs to be posted or held at the premises. And it also needs to be discussed with the employees, and it's probably not a bad idea also to have a COVID-19 point person as well. That would, all the questions from the employees would be directed to that person who is knowledgeable about all this. So those are some of the things that are required by the state. What we do know is that phase 2 will reopening, which includes professional services, retail, in-store trade, administrative support, real estate. Those businesses, we're hoping that they will get the thumbs up to reopen on June 1st, but that's going to be contingent upon what the numbers look like from the phase 1 reopenings. So, but again, those phase 2 businesses will be required to do the same thing. Go to that forward.ny.gov website and comply with that guidance. And now for the other news that we have, we just announced really today, became public yesterday, that Petrie Baking Products in Silver Creek will be reopening. They're going to be making soft cookies for the commercial market. It's going to be locally owned by the Habib family, who owned it before it got sold to ConAgra, and then ConAgra ultimately shut it down. Many of the same management team will be back. They know the facility really well. Just for a little clarity, it's about 13 acres of land. It's right on Main Street. I think it's 18 Main Street, right in downtown Silver Creek. They're going to be installing new ovens, cookie production, and other machinery and equipment. And it's about a $13 million investment, and it will result in north of 40 jobs to begin with, and build up to somewhere in the range of 100 jobs over the next 3 years. They expect to be operational in January if everything goes well. So I really want to congratulate the county executive, the IDA staff and team especially Christine Morbido, who worked really hard on you know, pulling all of the different entities together for funding and coordinating everything. So we're really excited about this new news, and you know, before you know it, the smell of cookies will be wafting in the air in Silver Creek. So that's very good news.
Thank you. Just to recap, we get a daily update from John Majori from the governor's office. And to date, we have 100 businesses that have filled out that Phase 1 affirmation. So as Deputy County Executive Geis said, we need to make sure that businesses that are on the Phase 1 reopening, you get on the website and fill out that affirmation. Please get logged in with the state. We don't want to jeopardize your status as operation. Again, Phase 2 businesses, be ready. If your business is not found on any of the Phase 2, 3, or 4 openings, as discussed in our control room, you need to be ready. We're not sure exactly where they fit. And as those businesses are out there, you need to be ready. They may be brought up to Phase 2 or delayed to Phase 3. We're not sure yet. But as we talked in our control room, if you don't find your business listed specifically, be ready to open because it may come sooner than you think. So again, we just want to urge everybody to be vigilant with that as well. But if you're in Phase 2, get on that website and get registered and get your plan affirmed. Really great news. I know when this first started, the plans were in the works for Petrie, and as the economic climate shifted here in Western New York, I was really concerned as for the progress of the Habib family and Petrie cookies. So again, as Mark could tell you, I was always asking, where do we stand with Petrie? And it was really exciting news yesterday to find out that that's moving forward. So hats off, and I think it's really going to be a monumental opening, but also just bringing some excitement back to the village of Silver Creek. So thank you very much, Mr. Geis and all of our teams for everything they've done, and looking forward to that reopening. Having said that, we're now going to move into the question portion. I do have a hard stop because the control room begins at 4 p.m. We do a lot of great information. A lot of action is coming out of that control room. So again, we need to make sure I'm there that we can move forward. So again, today we are going to limit our questions to 3 apiece. If we do have time, we will open it up at the end again. So we're going to start from the bottom and go up today. In this room today is Justin Gould from Western New York Now. Justin, do you have any questions?
Yes. Can either Executive Wendell or Director Schuyler go over the current number of how many of the cases are active right now?
Yeah, I can answer that. The number of cases active in Chautauqua County right now are 28.
And you said that earlier that was mostly due to people not following social distancing, or why are we seeing this spike of such a dramatic increase of 10 now?
Well, a few things to keep in mind. When we report new cases, it's the day that they are reported to us on the New York State electronic lab reporting system. So it doesn't mean that people were tested today or diagnosed today necessarily. It takes anywhere from a day to 10 days to get results on someone's test. The other thing is I said 9 out of 10 of the cases that were reported to us today are contacts of someone who was a known positive case.
Okay.
So when you're in contact with someone who has COVID-19, you're at very high risk of yourself becoming infected with COVID-19. It's very, very contagious.
Is that the number one concern when we look at spread of coronavirus? Or are we still concerned with people, if you're out in the community, you could get it by coming in contact with a stranger?
Both.
Okay.
Yeah, it's a respiratory droplet, mainly spread infection. So it doesn't matter if it's your family member or if it's someone that you haven't seen in 10 years and you run into at the grocery store and think you need to stand there and talk to them a few feet away. And for a longer than 10-minute period of time, we consider that a close contact. Wearing of cloth masks is required because that helps you to keep your germs to yourself and decreases the chance that your germs and your droplets are going to get through that cloth barrier to infect someone else. So all of these measures that we're taking are to try to control the spread of the disease, to try to keep one person from giving it to another, and then you're in a group, and then a whole bunch of people get it, and that's how we see this multiplication of disease, because we have something that's highly contagious.
And then the final question for me during the first round of questioning, do we know what the timeline and what the metrics are for stepping back in regards to reopening? And is that a concern because we had 10 new cases today?
I guess you would have to look at the numbers and where they fall in the metric. Backsliding right now would be to go into pause. That has not been discussed. I know we'll discuss all these options at our control room. But right now, what we don't want to have happen is, that backward slide which mean instead of 2 weeks moving on to phase 2, we could stay at phase 2 for an extended length of time. So we don't know exactly how that will be defined as we, when those things happen. But we're just urging everybody, we don't want to be in that position. We want to make sure everyone is still following the rules. And I think what's Christine Schuyler had said was, these cases aren't a result of our reopening. We reopened a few days ago. The incubation period, 7 to 14 days, does take some time. So again, keeping in mind that the spike we've seen in cases is not a direct correlation to opening as we had on Tuesday.
Okay, thank you.
Moving on, Mr. Frank from Media One.
Yes. Good afternoon, folks. I had a question initially about Erie County. I know earlier in the week, County Executive Mark Poloncarz has expressed some concern because their hospitalization rate has started going up. I know that we have no current hospitalizations. What kind of concern is there overall in the Western New York region about the possibility that we may be paused going into phase 2?
We really need to think about who gets hospitalized mostly with COVID-19. It's those who are older, who have underlying health conditions, and who really can't fight this off. So when we talk about the importance of social distancing, that 6-foot space, wearing masks, protecting others, you're protecting those who are most vulnerable, who will end up, most likely, in the hospital and requiring a higher level of care. So if you want to be selfish because you're young and you're healthy and you don't think you should wear a mask and you think you can go out and party with your, college friends, you are doing a disservice to everyone. Because even though you might only become mildly ill, those other people around you might become majorly ill, and they'll end up hospitalized. And that is one of the metrics that will absolutely set us back.
I appreciate that, Christine. The only thing I would add is my father and I went out socially distanced, and we were taking a ride, and we went by one of the local ice cream shops. I will not mention who it was. And the people that were there were many of them. They were not socially distanced, and most of them did not have masks on. So we were kind of frustrated because people by the rules, and other people obviously are not.
And some of this, a lot of this, comes down to personal responsibility and accountability, and we can't babysit, almost 130,000 people in this county, but we really got to have some common sense here and try to act like adults for those, other than the 20,000, I guess, that are children in the county. Act like adults and be responsible. And if you do see, especially a food service establishment or something like that, please let us know on that, and we will follow up.
All right. Thank you, folks. That's all I've got.
All right, thank you. Moving on, Dennis Phillips from the Post-Journal.
Yes, thank you, PJ. I'm wondering how much has more testing supplies being available impacted the increase in numbers in the county?
I think I don't know of a scientific, amount or a correlation to make, but whenever we have more testing supplies, we do more tests, we are going to uncover more disease. That works for any communicable disease or STD or anything that we're talking about. So you remember, we keep saying, as we test more and as we get out and about more, we are going to see more cases. It's our job, all of us, to try to keep that as decreased as much as we can, dampen it down as much as we can, and keep those who are really at risk for getting very sick out of that.
Thank you, Christine. Has there been an update on the sub-region plan as far as the governor's office made any kind of update to whether or not that's going to be something that comes to fruition?
We haven't heard any further discussion from the governor's office if that will come into fruition. We talked this afternoon, the leadership of the other two counties, and we all agree that, where we are right now with Western New York, we're okay with where we are. We will look at that and revisit that. That's still something that's out there and being considered. The governor and his office knows where we stand with this. This information has been shared with a couple different control rooms, so the understanding is there. Right now, as we're opening into phase one, we will consider that and look at that. But our point now is we are going to work together, the three counties, and also make sure that we are working in unison with the rest of Western New York. So we have that unified unity of effort and that approach moving forward.
Thank you, PJ. I was also wondering if there's been any type of update on when phase two might start, or is it still looking like that's most likely going to be 2 weeks from, Tuesday?
We ended yesterday's control room as working toward that June 2nd date, making it to phase two. So we haven't heard any changes from that. So we're looking at June 2nd. But again, it's going to be dependent on how we do, the responsibilities we take to make sure that these metrics stay where they're at and we're able to move to that next level. It's everybody. It's safety, it's economy. There's so many things involved in this.
Thank you very much.
You're welcome. All right, moving on. Mr. O'Connor from Chautauqua.
Thank you. I hope this doesn't count as a question. Would it be okay if Justin and I went into the control room to cover it so that people of Chautauqua County would know what's going on in a transparent manner?
Well, I believe myself and the mayor have been very transparent, but there is no media in the control room, not from anybody in Buffalo, Niagara, or any of the counties.
Well, that must be said. You're going to a meeting at 4 o'clock.
Correct.
Can we go in?
You could have to take that up with Lieutenant Governor Hochul. She's in charge of the control room.
All right. Do you agree with no reporters in those conferences?
I don't have an opinion on no reporters. The establishment of that control room and the control room and how it's run is that of the Lieutenant Governor.
All right. The Memorial Day ceremonies, and I'm a Vietnam veteran. I lost 3 close friends in Vietnam. Armed Forces Radio and TV was blown up 3 times while I was there. It's a very sensitive issue to me. I wonder about how you feel personally about the limit of 10 people, even if they're wearing masks and social distancing at Memorial Day ceremonies. Are you 100% behind that, or are you passing this off on the governor?
Need the answer?
I can answer since it was directed to me. I'm not passing it off on the governor. My father, too, was a Vietnam vet serving 2 tours in Vietnam and does know several that have lost it. So, yeah, it's a concern to me. But at this time, we have to follow the restrictions that are set. At some point, the governor really could have said we are not allowed anybody to be at these remembrances. But I think as long as people are practicing social distancing, if people in a solemn remembrance would like to go and visit those who have lost their lives and paid the ultimate sacrifice, then that's encourageable.
So there'd be no arrests made if there's like 11 people?
I don't think that's the point of the enforcement, not at all.
Well, the number is 10.
Correct.
Finally, when you run for your first election in November, are you willing to step up for the now clearly evolving economic tsunami of bad news, of closed businesses, unemployment, many businesses that according to CPAs I've talked to in the county will never reopen? Are you willing to say, I bear responsibility for that?
If you're willing to say that those businesses are closing as my responsibility or as a result of my actions, I can't say that. What we have done in Chautauqua County is followed the rules from the governor. We were in a statewide pause, so if a business is unable to reopen, I don't know how that would be reflective of my following the governor's orders and continuing the pause. I will champion for economic growth. As we've seen, the Petrie project had started. We have several other projects that were in the works prior to this, and we're going to continue to champion those causes and bring more. There are several plans we do have in effect that we're working at, and as soon as we are able to move forward and have a little bit more mobility, that we are going to get those projects started. There are several of them, and we will wait to see how they pan out once we come out of this economic situation. But yes, we are looking for economic growth and looking to champion growth throughout Chautauqua County. Any other questions?
Yeah, in regards to economic growth, how much of an effect has COVID-19 had on those future developments that you mentioned? I mean, we really had a great push of momentum, and then overnight it just stopped.
No interest?
You know, it's hard at this moment to say what the fallout's going to be exactly. I mean, we know of some companies that may not reopen, but as we sit here right now, I mean, almost every single business is planning to reopen, and you know there are supply chain issues, there are other issues. So right as we sit here right now, we don't know what that's going to be, but we should find out soon.
Deputy Geis, in regards to those who are in phase one, thinking about phase two, those businesses, if they needed more assistance, whether it was getting PPE or just guidance on how I should conduct my business now, what's the message for them? Where can they turn?
They can contact our office, 661-8900. That's the IDA office, and also go to our website, ccida.com. And you know, we've got business development managers that are fully aware of what's out there, what's available, what assistance we can provide. So I would say that would be the best place to start, and then we can guide them in the right place.
Have you had a lot of feedback from businesses who need assistance now during phase one reopening?
Yeah, I mean, we had the working capital loan program that we launched, and we lent out $250,000, $10,000 at a pop, so to 25 different businesses to help them get through this. And then we've also had 40 businesses that applied for and are going to receive assistance through a grant program that we also started to help them purchase the PPE, and also for technical assistance through Jamestown Community College. And we've got a waiting list. And so we're out there actively trying to get more funding to continue to do that. And then there's also funding available through the Stimulus Act, through the EDA, the Economic Development Administration, that we're applying for funding there as well to help businesses.
What do you think the biggest, and it can be more than one, challenges that businesses who are reopening have to face now?
Well, certainly, like I mentioned, supply chain. I mean, a lot of these businesses are saying, well, we could reopen right now. We could get our people to come back, but, we need to get the parts. We need to get the stuff that we need to make what we make. And a lot of those supply chains are not fully intact at this moment. So I think that probably will be the biggest challenge.
Do you imagine that communicating with customers, I know the County Chamber of Commerce has done a fairly good job of reaching out to businesses and trying to help them let customers know that they're reopening and that there's the safe guidelines, but I imagine for some people in the county, there's such a wide array of people who, some of them are comfortable with going out now that we're out of the pause, but others maybe are not. Is that something that you guys are looking at and trying to communicate?
Yeah, our business development managers, we have 3 of them, have been in touch with all of the businesses in the county, have been reaching out through this whole thing, communicating with them, finding out what their challenges are, what their issues are, providing guidance. And, we have heard that, a number of their employees are jittery about coming back, and that's why it's so important for them to follow these guidelines and have these templates, these safety plans in place. So, and like you said, the Chamber's done a nice job too of having these weekly meetings. We've all linked together. I mean, we talk every week in fact, we had a meeting this morning with the Chautauqua County Visitors Bureau, the Chamber, the foundations, and through the Partnership for Economic Growth that we recently launched, there's been a great deal of communication between not only the private sector, but the not-for-profits and also the foundation. So we're all communicating, and the business community. We have a business advisory board, so they're kind of feeding us what the main points are or challenges are of the businesses.
Okay, thank you, sir.
You're welcome.
All right. That everyone is able to enjoy the Memorial Day weekend and take some time to think about those who have served our country and made the ultimate sacrifice. Hopefully we get some nice weather and you're able to enjoy the outside and the fresh air. But again, please do not host or attend large gatherings. Try to limit your errands. Please maintain proper social distancing, wear your face covering when out in public and unable to socially distance. Remembering throughout all of this, following these guidelines, we will come out on the end and continue to be CHQ strong. Thank you, everybody, for attending. We'll see you next week. Thank you.